Hi everyone, this is Samira Daswani here, the host of the Manta Cares podcast. Our podcast is called The Patient from Hell, partly because I came to realize that I was a patient from hell and found many, many others like myself. Today I have Jane joining us. Jane is a phenomenal individual that I happened to meet this year at the ASCO conference. Jane, I'm so glad that you made time to join us today. We'd love to hear your background if you don't mind, starting there. Just tell our audience about who you are and what brought you to ASCO this year.
Hi, Samira. Thank you so much for having me. It's a real pleasure to be here. And hello, everybody. So a few words about myself. My name is Jane Gutkovich, and I met Samira at the ASCO conference because I was there as a patient advocate for an ultra-rare vascular sarcoma called Epithelioid Hemangioendothelioma. Yes, it's a mouthful, and it took me 2 weeks to learn how to say it. So for the clarity and simplicity, we're going to call it EHE. That's what we usually call it in our community. What did I do at ASCO? Advocating for our patients, trying to learn what's new in the cancer field, trying to meet other wonderful patient advocates. It's always very, very exciting to be at ASCO, and it's also very, very excited to meet people who can teach you and who you can connect and become real friends. And that's what I think happened with me and Samira. I can say a few words about how I became a patient advocate for EHE.
You stole my question. Go for it. That was going to be my question. You nailed it.
So it's almost 10 years ago, actually. It was in January 2013 when my son, who was 23 at that time, was diagnosed with this rare cancer. And of course, he was a young guy, perfectly healthy. He started coughing and, usually think it's just a cold. Cold doesn't go away. He's still coughing. Antibiotics don't help. Finally, his doctor decided to do a chest x-ray, and we found a huge, really big tumor that was lodged between his lungs. As scary as we were at that time, but his doctor assured us that it's probably benign, and he thought it's the tumor that's called teratoma. So he said, we just have to find the right surgeon and we'll remove it. We found a good surgeon at Sloan Kettering Cancer Center in New York, where we live. And the surgeon looked at his testing, at his scans, and he said, unfortunately, it's cancer. It's not benign tumor, because he found metastasis in the liver and in the lungs. It took a couple biopsies and a really long time to have the right diagnosis, when finally one of the doctors called me and he said, I can't really pronounce this. I have to spell it for you. So that was already a red flag for me. Of course, I started looking at what it is, and I realized how rare this cancer is. We went to the best sarcoma specialist in a country, and I'll tell you a really funny story. If you can laugh about cancer, that's the one. So Dr. Sloan Kettering, who was amazing, he's still amazing, his doctor, Dr. Bill Tapp, he was very honest. He said that this is a very rare cancer, even among sarcomas, and he hasn't really seen this type of presentation. And he said, feel free to go for a second opinion. And he gave us a couple names who all were top-notch sarcoma specialists in the country. At that time, Dr. Tapp recommended chemotherapy, try to debulk the tumor before the surgery, and then to remove it with the surgery. We went for second opinion to another sarcoma specialist at Dana-Farber, and to our greatest surprise, he said, I would not recommend chemotherapy, and I would not recommend surgery. Usually this cancer is very slow growing. Let's just watch it. I'm afraid we can do worse than better with both approaches. So that, of course, turned us upside down because they gave totally opposite recommendations. We decided to go for third opinion. And a third doctor, MD Anderson, who was very familiar with this disease, said, I would not do surgery, but I would go with chemotherapy. We decided to go for fourth opinion. And I remember driving in a car to this doctor, and I look at my husband and I said, you want to bet that because it's only one combination left that this guy will say yes, surgery, no chemo? And sure enough, that's exactly what happened. So we saw 4 best sarcoma specialists in the country, and they all gave us totally opposite recommendations.
Wow.
And what do? Well, you learn and you have to make your own decision. So I got on internet, and luckily I had access, because I work in healthcare, I had access to medical literature. And I realized that medical literature wasn't helpful either, because you read one case and you read another case, and they totally opposite. Doctors having different approaches, doctors recommending different types of treatments, doctor recommending different types of scanning. It was all over the place. I was really lucky in my research on internet to find a woman from Australia. Her name is Cynthia Pollock, who was also a mom of a patient who was diagnosed with EHE in 2004. Unfortunately, he died from the disease about 7 years later. But while he was still fighting this cancer, she managed to find on internet rare cancer charts and establish a first EHE registry.
Wow.
And without any funding and without any guidance, and that was before the Facebook and before all these fancy tools that you can find on internet now, she managed to collect about 300 self-reported EHE stories from the patients from all over the world.
Wow.
She was contacting these patients once a year by mail. Yes, she was writing letters at that time, by phone calls. And she was telling me sometimes it's 3:00 in the morning in Australia, but what are you going to do? I have to call where people are comfortable talking to me, through emails. I learned from this registry more than I learned from any publication and from any sarcoma specialist at that time, because it was a collection of self-reported stories when people really tried to share everything that they knew, everything that they experienced, everything that was happening with them, and any type of treatment that were undergoing. So it was 2013, and of course, this way I found several patients all over the globe, and we started talking, and we realized that the only way we can find any information and move forward with it. By that time, my son already had a surgery. Luckily, the surgery was successful. He also had chemotherapy, and we ablated tumors in his liver with, at that time, experimental type of ablation called irreversible electroporation. So he was doing fine, but I knew that he still tons of cancer cells in his body. So I got in touch with some patients, and we knew that we have to do something, and only by organizing a very tight community, we can succeed. One of my EHE mates, her name is Dawn Scott, she had this brilliant idea to launch an EHE Facebook group. And it was launched in September of 2013. It was first 7 or 8 of us on this group. And I remember every day, 5 times a day, I was checking everybody if anyone else joined. And every new person was like, yes, we have another person join. When we had 20 patients, I remember, I still have this post I posted, we have 20 patients in a book. We're not rare. Like it's 20 of us. And by the way, today we have more than 2,400 members in our EHE Facebook group from almost 80 different countries. So that was the beginning of building of EHE community. And of course, first thing we realized that there is no research. Nobody knew what this disease is, what drives it, and most importantly, how to treat it. So we started doing what any cancer community should be doing. We started fundraising. We started collecting information. We started reaching out to doctors and researchers and just trying to kind of bring in and it was very successful. In 2015, this community became a base for the EHE Foundation. The EHE Foundation was born in February of 2015, and 3 founding members, including myself, were all from this Facebook group. And very quickly, we brought a few more patients. And at the beginning, almost everybody in this foundation were the patients. There was just one person who was a friend of one of our patients. And we rolled up our sleeves and we started working. Grassroots fundraising was very difficult because at that time we didn't have any experience in grant writing, we didn't know who to go and who to ask. But we knew how to talk to our patients and we knew how to deliver the message. You know, guys, we just got to do it. If we don't do it, nobody else would. I always give the example that I think is a total parallel with our situation at that time. You know, the famous saying that when I was thinking to come to America, I thought that streets are paved with gold. And when I got to America, I realized 3 things. First, they're not paved with gold. Second, they're not paved at all. And third, it was me who was expected to pave it. That was exactly where we found ourselves. There was no research, and it was up to us to jumpstart it. And we raised significant amount of money. We jumpstarted a first EHE dedicated lab at Cleveland Clinic. We started collecting data, and we extended that first registry and collected a lot of information. The EHE Foundation reached out to best specialists, sarcoma specialists in the world. We established a wonderful advisory board. It's hard. It was really, really hard. And we made mistakes, but we learned from our mistakes and we were moving forward. So from 2013 through 2019, I had 2 hats. I was a vice president of the EHE Foundation. I was the director of research, and my responsibility were to do pretty much everything, but so was everybody else, you know, because it was so few of us. We were just doing whatever we could and helping each other. Now the foundation is very different. We have professional staff. We have very diverse board of directors. We received several very large grants, including a good grant from Chan Zuckerberg Foundation for Rare Disease. We're funding at least 5 or 6 different research projects. So yeah, that's my road. That's my route to where I am now. And even though I moved to position, I kind of left my position in the EHE Foundation because I want to focus more on helping patients and communicating with our community and communicating with researchers. But it's a very tight community, and I am still extremely active. And that's how we met at the ASCA conference.
That's incredible, Jane. Thank you so much for sharing that story. I have quite a few questions for you. And if you wouldn't mind, I'd like to actually go back in time where all of this began for you.
Sure.
So this is you're in the car driving to the 4th opinion. You're telling your husband that with permutation and combination, there's only one combination left, and this person's going to give you that combination. So now you have 4 opinions from 4 docs from 4 phenomenal institutions in the United States. Basically, the best you can get. And I think you mentioned this briefly. I think you touched on it. You're like, the only way I could make the decision was by finding other patients who had done it. But how did that happen? Because I'm guessing this is happening on days in a time when you don't have Facebook, you don't have the community set up because you're still kind of figuring it out. How did you make that decision?
It was one of the hardest decisions of my life. And I would be lying if I say that I gathered information that I needed in order to make this decision, because there was no disinformation. Yes, I found several patients with similar presentations, and most of them had surgery. But for example, one patient died because the surgery, the complications of the surgery. And my son's surgeon warned me. He gave me a list of all possible scenario where my son can either die during or after surgery, or bleed to death, or like soon after, or have a stroke. You know how you sign the consent for everything. So, just to give you a little bit of perspective, sarcomas are 1% of the cancers. EHE is less than 1% of the sarcomas. This mediastinal tumor that my son had, mediastinal is in between the lungs, was less than 0.001% of presentations of EHE. So I found 5 cases at that time. 5. How can you make, and these people had different presentations. Some patients, in few patients, it was not growing. And some, I knew in my son it was growing. Some people had chemotherapy before, some people had chemotherapy after. So no, I cannot say that I made a decision based on the information. Yeah. It was almost, it would almost who do you trust? And till the end of my life, I'll be extremely grateful to my son, oncologist, who said something that was the only right answer. He said, that's what I recommend, but I'm not sure. And you have to understand that this decision has to be yours. He was honest with me. He didn't have any ego saying, I'm a doctor, I know what I'm doing, you better do what I said. No, he was honest. And a surgeon at Sloan Kettering, after I questioned him a million times, I'll never forget this. He looked in my eye and he said, you simply don't have a choice. Yes, it might happen that he will not do well with the surgery. But if you don't do the surgery, then he's definitely not going to do well. And yeah, we just went with, we just had to make a decision and go with it and pray. And I have wonderful coworkers from all different religions. And I remember morning of the surgery, on my shelf on a wall, I had Christian artifacts. I had water from some well in France, and I had Quran, and I had Native Americans little statues, and I had something in Hebrew, and I all religions. And I look at all these things, and I said, well, guys, whoever on call today, we can use some help. Because that was the only help at that time that I could get. So I can't even answer this question directly, because it was just, we knew we have to make a decision, and this decision was based not on what's the right decision, not to what to do, but what is scary not to do.
Yeah. No, I really appreciate you sharing that, because I think there are a couple of reasons I wanted you to share it. We've had a couple of episodes on this podcast where we talk about decision making. And we talk about how patients and caregivers think of decisions. And when we think of a relatively common cancer, like I had, breast cancer, fairly common, you're navigating almost the opposite of what you're describing, because there's so much information. You're on the very other end of the spectrum, where you are trying to navigate truckloads of information coming your way, because for good or bad, you have lots of options, but then you do make lots of decisions, right? So it's a sequence of decisions you're trying to make, and you're trying to understand the complexity of the science. So the problem for a breast cancer patient today is that we are fortunate and have data, but then you need to understand how to interpret the data. And then in hearing your story, on the rare cancer side, you're on the very other end of it, where you don't have the data. At best, you have patient stories and case studies. You have 4 opinions with 4 drastically different options, and you need to rely on some combination of like trust, faith, and instinct to make that decision because you don't have the data. So I really, really appreciate you sharing that story, because I think our audience is pan cancer, and we have people with experiences along that spectrum, right? And at every little pit stop in the middle there. So I really appreciate you sharing it. I have a follow-up, Jane, because there's something that struck me in talking to you both at ASCO and then again in this conversation. It's you're a mom and you have an adult kid, right? Because your son at this point in time is not on, he's 20 something, right? He's in his early 20s.
He's 30 something already. Yeah.
He's 30 something today. So at diagnosis, he was probably early 20s, right? So
Yes.
he's not a minor where you have the legal decision authority. So how did he factor into all of this? Was he pushing for something? He was like, Mom, I can't do this. You tell me what to do and I'll follow it. How did he factor in? And I asked this because we have a lot of people who are probably grappling with similar things that you were probably grappling with, where they are the patient, and they are not the patient, they're the caregiver, and they're on proxy for the patient, but the patient is also part of that equation. So I'm curious if you can talk a little bit about
It's an excellent
you,
question.
your son, opinions, how you decided it.
It's an excellent question because, you have to factor in so many things. Me and my son, first of all, we've been always very, very close. It's not like he lived his life, I lived my life, and then I jumped in. I always gave him his space, but we're very close. So it was only natural. He knew my thinking. He knew how I approach things. And I think that laid some foundation for him to trust me. Also, me working in healthcare, having some basic knowledge about anatomy, physiology, pharmaceuticals, I guess gave him some confidence. He also knew that I will not stop at anything to get the right answers if those answers are available. And we were all in it. Me and my husband and my older son, we were all in it. And I think he kind of saw that there is a team that covers, and we were not always on the same page. Don't get me wrong, there were fights and there were screams, and then so I think my son kind of decided that he cannot do better than I do, than this team will do. Even if he decide to learn himself, he won't be able to learn more. And he took this position of, like, I'm not going to dig into what you dig in. Give me your opinion. I'll trust what you're saying. It has to make sense to me. He was never like, okay, just whatever you say. I had to present him my rationale. But that's kind of relationship that we developed after he was diagnosed. And there was another thing into that, because the same way I was worrying about him, he was so much worrying about me too, because he knew what it means for a mom to face your child diagnosis with cancer. And I think that part of him was, well, that's what makes mom, but that empowers her and what makes her feel better, because it's true. We all different people, and I belong to patients who needs to understand everything, to have a full control, to make sense of everything. And if I don't, then I'm panicking, then I'm not comfortable. So I guess he also did it for me, because he saw that digging on internet till 2:00 in the morning and being on a phone with different countries and talking to doctors and going to God knows how many different conferences and learning genetics and epigenetics and whatever I could learn at the time, it also keeps me occupied with the purpose that makes me feel better. I hope I answered your question.
Oh, that was a beautiful answer. That was such a phenomenal answer. I think there were two huge takeaways for at least me. Takeaway one is, and you said it so beautifully, that going through cancer is not individual; it's going through it as a team. And you guys became you already were a team from a family lens, but when it came to this diagnosis, you approached it like a team. That's actually exactly how my family did it too. We have this hilarious picture of us. It's six of us, and everybody has their role because everyone needed a role. Because my mom she's a chef, she was head of nutrition in house, like no way. My dad was the one who was playing the medical information with me, who was my back team. My one brother was in charge of communication. We joked that he was the director of communication, where his role was to communicate with people who were reaching out to us because it was too much. Then the other sibling his role was director of morale. He's the most sensitive in the family, and morale takes a hit some days. Some days are just hard, and no matter what you do, they'll just be hard. And he was in charge of making sure people laughed and had funny things in their life while going through a dark period. My partner was in charge of the house. So when you said teen, I was like, yes, I know exactly what that means. That's exactly what I think the experience is for a lot of people. And I think the second thing you said is honestly why we named this podcast. Because we call it the patient from hell because there's always someone in the family, someone in that unit on that team that is playing that role where they are grappling to understand the information. They are questioning the doctors, not because they don't trust the doctors, but because they need to understand and they need to figure out what makes sense, because it is some combination of intuition meets information meets trusting clinical opinion. And I love that you said that, because I think in my little team, I was definitely that person.
Yeah.
I was the 2 a.m. on PubMed looking at abstracts. that was definitely my role. I appreciate you sharing that. I'm going to go back to your initial story and zoom all the way to the other end. So here you are many years later, your son is 30 something. I don't know exactly how old he is, but he seems to be doing well. And you are sort of in a life transition mode again, and you're giving back again to the community, maybe with a different hat on. I'd love to better understand that. I heard you say something like, I want to support patients. I'd love to hear what that means for you today.
So I've been always in touch with many, many patients, always, regardless how busy I am. Because, you feel for these people and you've been there. And sometimes you actually know that you can help. So the Facebook community undergoing certain transitions, I would say. At the beginning, when it was like 100 of us, we knew each other. We knew everything about each other's families, dogs, and of course the treatments, and it was very close. The more people come into online hub, the more difficult to keep a track of everybody. And what's also very interesting, all the successes that the EHE Foundation actually achieved also sometimes in this really weird way plays against this community to remain very tight. Because what kept us tight? Lack of information. Because when doctors go to the doctor and doctor will tell them, I have no idea what to do with you. I've never seen this cancer before. They stick to the community. It was us, the community, and the EHE Foundation, not only of the US, we have sister foundations in Australia, in UK, in Italy. There's some people in Canada that are doing it. The more awareness we spread, the more research we brought it out, the more information we spread among the doctors about successful treatments, the more doctors know, the better they treat patients, the more confident they are about treatments. People don't feel such a need to be constantly on Facebook. And it's really interesting because I'm totally divided. Half of me is, that's exactly what we wanted. Yeah. That's exactly what was our mission. And a second part of me is, but we're losing this connection. Of course, we're not losing connection with everybody. But I think those bonds that we experienced at the very beginning, they kind of loosen up a little bit. And some people come on Facebook only when they have a question. They're not following everybody. Some people come on Facebook once they post their story or they ask a question and they never come back. And then a year later or 2 hours later, they post something that, like, I wish I knew it before. Like, I would give you some information, or it's not that I never give medical advice, but I provide information. So I kind of want to try to find some new ideas of how to keep patients engaged. And also, people who are coming in a rare cancer might not understand the necessity of this tight community and collecting information and still doing a lot of grassroots fundraising. So I see my role in keeping this community together by whatever means I can. And I'm trying to be very active on Facebook. I'm trying to, when I admit patients, I'm one of the administrators of the Facebook group. When I admit patients, new patients to the group, I'm trying to engage with them and tell them about myself a little bit and tell them that I have the whole library of cases and if they want, they can share with me some information about presentation of their EHE, and I'll send them similar cases. I'm happy to talk on the phone. I give them some links to the research, to current clinical trial. It takes a lot of time. And, not everybody responds to that, which is fine. I never hold anything against people are different, but I try, and it gives me great satisfaction to see that I do help a lot of people. I'm also doing regular webinars, educational webinars for our community. Most of them are going through the EHE Foundation. We have a wonderful series of community connection. We invite doctors, but I do mostly educational. Like my next one is actually on October 26 or 29 about what immunotherapy is and what its application for EHE and what knowledge we currently have about how effective it is for EHE. So I'm trying to bring patients on these webinars and kind of engage. So that's one head. The other head that I also focusing now is to learn more about latest breakthroughs in cancers, not only in EHE, not only in sarcomas, but in cancers, because we know now that this whole division of cancers, breast cancer, this is lung cancer, it's going away. 25 years from now, there'll be no breast cancer. It'll be cancer that has these mutations that originated in this patient. It's going to be totally different division. So I'm trying to learn what's going on in other cancers, all the breakthroughs. I'm trying to communicate with researchers and physicians, provide them with information that I find in our group, getting some feedback from them. So it's almost the same as it used to be, but because we have a professional foundation now, and I always come with professional organization, it's a lot of administrative things. We have to keep our books in check. We have to do meetings. We have to do. So I kind of decided we have professionals that doing great job. I want to be 100% dedicated to EHE and EHE patients.
That's incredible. I love the story. I want to ask you a little bit more about your research background, because I feel as though it's been a common thread, both personally and through all of the work you've done in the foundation and the work you're doing right now, which is trying to understand what that next frontier in cancer is going to look like 25 years from now, and make sure that you're communicating and making sure the community that you're a part of is keeping abreast with it. So I'd love to learn, where did your love for science come? Where did your love for research start? How did all of this begin?
Well, first of all, I'm a nuclear tech, right? So I went to school for nuclear medicine, I had background in basic medical field already. As a manager of a nuclear stress lab in my career, I was involved with a pharmaceutical company because I was helping them to implement a new pharmaceutical for stress testing, for cardiology stress testing. So at that time, I was involved in studies, in analyzing data, in looking into pharmacokinetics. So I had exposure before. My love to science been always there, not necessarily to medicine. I was at some point very much into quantum mechanics and quantum physics and theory of relativity, but that was a long time ago. Yeah, so science was always my strong. So when this happened, I just started learning. I didn't know much about genetics. I had high school genetics from 40 years ago, which was not very helpful, or biology. I started learning. I took, you can take MIT free classes online.
Yeah.
Okay, I started taking cell biology. I started taking genetics. It's very hard because you're kind of trying to grasp it on a high level. And I learned how to grasp it on a high level. If people ask me like how to go through all this, but you can't, I cannot talk about it. But when someone talks, I understand. It's almost like, dogs cannot talk, but they understand. Like I consider myself in this term, like I'm like a dog. I don't have vocabulary. I don't have language, but I understand on a level that's enough for me. When it's not enough, I go and I learn more. And of course, you cannot learn anything about cancer without learning how clinical trials are done and how doctors and researchers are looking at the data from these clinical trials, which, very limited. And everybody understands this, but that's the best we can do now. I'm listening to podcasts, actually, when I drive to work. I'm listening to podcasts in immuno-oncology and the podcast in peer reviews of current clinical trials. And, you take little things and you see how things are done in other cancers, and you think, well, that may be something that could be applicable to EHE. So it's general education, kind of filtering information that can be helpful and see where our research can go. I don't go to researchers. I don't tell them, I think that's what you should do. But when they do something, I have much better understanding. And I think connecting them with the community, because, it's not only about money. Researchers need tissue, right? And the rare cancer's tissue is gold. So I'm able to connect with community and explain to them why it's such a big need for the tissue, and participate. Like we have a biobank, the EHE Foundation has a biobank. So I'm trying to advocate for patients to keep it in mind if they're going for surgeries, to send us this. So again, research and science been always with me, but of course, last 10 years, it's cancer.
I totally get that. I completely get that. I'm still hung up on your dog analogy. I think it's a beautiful analogy, actually. It's a phenomenal analogy because I think it's the role of the patient and caregiver. And I think it's a really good analogy for that because most patients and caregivers will not ever, I shouldn't say never, but most of us are not researchers. We're not the scientists in the white coat in the lab doing the research. And yet we need to figure it out enough, both for our own case, but then also to drive the field forward. So I think that analogy actually is both really funny and pretty apt. So thank you for that. I usually try and summarize what we've heard today, and I feel as though we've touched on so many themes and threads that I'm going to aim at summarizing it. And if I miss something, I invite you to correct me or add things. So The first thing I took away was the interaction between a mom and an adult son navigating a rare type of disease. That relationship is sort of foundational to the entire experience. And being a team as a family, going through something together, identifying roles and relying on each other seems to be a sort of consistent theme through your experience. So that's one for me. Number two is how different navigating a rare cancer is from a decision-making perspective than a more common type of cancer, such as breast cancer, where as opposed to being inundated with information, you're grappling with very little information. And you are relying very, very heavily on other patient stories to understand the disease, understand the implication for your life, and then make a decision. Number three is the importance and consistency of community. How absolutely critical it is to have these tight-knit communities, both at the outset of a community where nothing exists, those 100 people that get to know each other and start something that will outlast them ideally and has grown substantially, but also what that means from an evolutionary perspective. Because now that that community is much larger, there is more interaction, but maybe not as strong bonds. And how do you recreate the stronger bonds, even as growth has happened? Growth both professionally for the foundation, but also for yourself, because you have also evolved over the last 10, 15 years and what that means for you today. So I really appreciate you sharing all of that. Did I miss anything? Is there anything?
No, that was excellent. Thank you. Thank you.
Thank you so much for coming today, Jane. I really appreciate
so much
your story.
For having me, and best of luck with everything.
Thank you.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The content here is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.